Hey guys. So it looks like we have a couple more minutes, so I'm just going to wait a few minutes before I start talking about anything. Um, is there any of you who needs to get this module done still?
Scrub again for 50.
Yeah, I do have to finish
I
it.
still have to finish.
Okay. I think it looked like the due date was the 24th or something like that. So I think you still have a little bit to do it. So if you, for some reason, it's not working right, just let me know and I can change settings or something.
Okay. It's been working though. Are we gonna have math on our test?
Yeah, there's 3 math questions.
Okay.
Yeah, there's 3. And the 2 of those out of the 3 are just like pretty simple math where, it'll ask you like, um, hey, you have this much of the medicine and this is your order. How many milliliters are you going to give or how many tabs are you going to give? It's going to be simple like that. And then the other one, the third one is it's going to ask you about what time would this IV infusion be complete? So that's kind of what would be on the test.
And just to confirm, it is like from 1 o'clock like to 2400, not 1 o'clock 12 restart.
Yeah, so with military time, you start at 1 p.m. and that would be 1300. And then you keep going, around the clock until you get to midnight. Midnight would be 2400.
Okay.
And then 1 in the morning would be 0100.
Okay.
If that makes any sense, hopefully. Okay, so in this module, it looked like you guys were doing a little bit of IV stuff. So back when we were on campus, what did you do with IVs in lab?
She taught us how to like bag the stuff on the hooks, and start the flow. Like I can't explain it. Like to lock it and stuff like that, and to type it into the um the screen. Like you know what I'm saying? How to
Mhm.
type it in so it can do the right flow and stuff like that. And how to put 2 IVs at the same time, like 2 different types of fluid at the same time. So we did a little bit on it.
Okay. All right, so in this module this week, they basically were talking more about IV pushes, IV piggybacks, and IV bolus, it looked like. So let's kind of just go through those a little bit, make sure we're all on the same page with what you need to know about that. So with an IV push, this is a medicine that you would give through the IV that maybe, I don't know, like could be pain medicine or something along those lines that you would be giving IV push. So, like, say your order said morphine 4 milligrams IV push every 4 hours as needed for pain or as needed for severe pain or something like that. So then, you go in and you see your patient, and your patient has a pain level of a 7 on a 1 to 10 scale. So that's pretty severe. So you would go and get this morphine. So when you're giving an IV push, there's certain things that you need to do even before you draw it up. So what kinds of things do you need to worry about when you're giving an IV push?
The phlebitis, like IV site swelling.
Okay, so you need to make sure that your IV site is okay before you even give it. You're correct. What else?
Maybe like the calculation, medication calculation.
Okay,
making
if you
sure
have a
it's-
calculation, sure, you would want to do that first. So what I'm getting at is, so in our little scenario that I just gave you about the morphine, so you're giving morphine, so you want to look up morphine, right? And if this person has an IV that's hooked up to
Right.
running fluid, you want to make sure that it's compatible with that fluid. Because sometimes certain medications aren't compatible with the fluid that this person has going. So how do you find out if it's compatible or not?
Look up the order.
Well, you should have a medication book. And so usually, at whatever facility you might be at, they'll either have a physical book, or maybe you look it up online, one of the two. So you're going to look in the book and you're going to say, okay, I'm looking under morphine, and it should say in that whole, write-up about morphine, this is what it's compatible with, this is what it's not compatible with. It should tell you right there. Also, if you were ever unsure about it, who else could you ask?
Pharmacist.
The pharmacist, definitely. They're a great resource. So if you're ever unsure, like about a medication calculation that you do or something like that, the pharmacist is a great resource for all of that kind of stuff. They're really, really knowledgeable about everything with meds. So yeah, we would want to look this up. So things that we would want to know, we want to know what this medicine is, what it's supposed to do. We want to know if there's any kind of, contraindications for giving it. So with morphine, what kinds of things might we not want to give it for?
Low heart rate.
Maybe, but what do narcotics do to your vitals?
Tanks it.
What's that?
I said it tanks it.
Yeah, it can make them go down, but
Yeah.
which one in particular are we worried about the most with a narcotic?
Heart rate.
Respirations,
Respiration. Okay.
right? Because you can have respiratory depression from this. So if they're already low with their respirations and then you go to give this narcotic, it's going to make them go even lower. So that would be a contraindication for giving it. And you're right. I mean, it can affect some of the other vitals, but the respirations are kind of the most important one with that. All right, so we want to know what it is that we're giving. We want to know if there's any contraindications. And then you would kind of look at the side effects and say, okay, what could I watch for, And then we look to see if it's compatible with the fluid that's already running. And is there anything else that we should be looking at?
Maybe like assessing the patient for any of the unexpected symptoms,
Okay.
and having maybe preparation for in case anything happens.
Okay. You always want to make sure that you have any kind of medication available that you might need to counteract the medication that you're giving too, right? So we know that with narcotics, we would need Narcan. So you would want to make sure you have that available just in case you need it. Sure. So anyway, with IV push medications, there's a couple things that you do first like that. So you look all that stuff up, and then you definitely want to look at your IV site first and make sure it's okay. So how do you know an IV site is okay before you give something? What kinds of things would we be looking for that might indicate that it's not good?
If there's like any redness,
Okay. Anything
It
else?
should, it should be dry, so like any like maybe blood or moisture around it.
Yeah, because if it's leaking or something, that's a problem. You're right. Also swelling, we're looking for that. So like if I had my IV site in my hand here and like say it's in this way, it's facing towards, up my arm, I would look, like right here. So like here's my cannula, I would look right here. So I'm looking for swelling, because if there's swelling, that means that, whatever is going in the IV isn't going in to the vein anymore, it's going into the tissues around. So that would be an indicator that, it's not good. Other things, like if you're feeling around the IV site, if it's infiltrated, which means that, you have the swelling and that the fluid is not going in the vein anymore, sometimes you'll actually feel a cooler area right here, that area I said we're assessing. Like if you actually put your fingers there, it would feel cooler to the touch compared to somewhere else that you were feeling. So that might be something else you would watch for. Okay, so if this person had just an IV site that was not hooked up to fluids already, and we were giving an IV push, you always have to have a flush for before and after whatever you give. Now, if this person is already hooked up to fluids that are running continuously, then you don't have to worry about that because they already have something going through there. But you always have to flush before and after you give, this medication. So, with this morphine, then we probably would want to get a set of vitals before we give it, make sure everything's okay with this patient. And then we would assess their pain. And, what are some things we ask about pain?
Location, how long they've had it,
Intensity.
what type of pain it is, like is it dull or sharp pain, what is it on a scale of 1 to 10?
Aggravating factors of pain or what
Yeah.
makes the pain feel better, stuff like that.
Yeah, so you want to get all of that nitty gritty about this pain level before you even give the pain medicine. Then what do we know about IV medicine when we give it? How quickly does it work?
Very quick.
30 minutes.
Well, it can work within 15.
Yeah.
So it's pretty quick. So, you know how they always tell you to go back and check your patient after you give the medicine to make sure that it's worked, to do your reassessment and everything. You would probably go back in 30 minutes after you gave it to reassess the pain, but it'll actually probably start kicking in more around 15, 20 minutes than it would 30. It would be a little quicker. So that, you want to keep all of that in mind when you're giving your medicine. Okay, so in my example then, this person already had running fluids going. So I'm going in the room, I'm going to give them this morphine. So, when you look at an IV line that's already hooked up to someone, it has all these different ports on it, right? Usually there's, quite a few different ports that run all up and down this line. So you want to pick the port that's closest to the patient. So, if there's a port like right here, that's the one I would use instead of the one way up here. So you are going to, anymore, we get needleless everything. We don't have like, when we go to give something, we don't necessarily put a needle on the end to give it to someone, even though we do that at our school because that's all we have. But in real life, they do everything needleless because we're trying to save, someone from getting stuck accidentally. It's more of a safety thing. So they have these needleless connectors that you would put on the end of your syringe. And basically it's just this little plastic thing that you basically just would unscrew it when you're ready to put it onto the port. You're going to clean off your port first, and you do, your alcohol swab, and you do this twisting motion, and you want to do that for a good 15, 20 seconds. And that's like scrubbing the hub, right? So it doesn't hurt to not only get the tip of the hub, but all around it, everything. Just really scrub it well so you get rid of any type of germs that might be there. Because you got to remember, anytime you give anything to this person in any one of those ports, that's an opening into there. So bacteria and things could get in there very easily, especially when they're not covered. I don't know if you guys have been in a facility anytime recently that you've seen those little green things that they put on top of the ports on the IV line. Have you seen those? Anyone? So they have these little things. They're green. They're really tiny, and you basically just screw them on to all of the ports. So when the IV is not in use, it keeps those ports clean so you don't get bacteria and things in them. And then when you would go to use one of the ports, you would have to take it off, throw it away, and put a new one on when you're done. So did you know there was such a thing?
Now I do.
Okay. Well, you'll see. When we get back to school, I can hopefully show you guys that stuff. But basically, you're cleaning off your port. You're going to put your syringe onto the port, and the syringe is just like a twist on. So the port itself, you have to push in and twist to get your syringe on there. And then when you're doing an IV push, you always want to make sure that you have a watch with a second hand. So many times, when you're looking your med up, it'll tell you in the med book how fast to push it. So certain things might be, quicker than others, but some things might be super slow. For instance, if you were giving low pressure, metoprolol through the IV as an IV push, you have to wait 5 minutes. So it's like a super slow IV push. So, and you're supposed to be watching the heart monitor as you push that. Like, it's crazy, some of the things that we give. So anyway, in your manual, your medication manual, it'll tell you how fast you have to push it. So you have to look at that. That's one of the things you do beforehand. So anyway, we have our syringe on here now, and we're getting ready to push this. And we have to look at our watch to make sure that we're doing it, over the right amount of time. As we're pushing this, I know this seems weird, but with this person that has this IV line already hooked up, you have to kink off the line after the port. So you know how you have your syringe on the port, that you're getting ready to push this with. So after the line, after this port, you're going to kink off that tubing, because if you don't, when you're pushing this medication, it's going to go up into the bag instead of into the bloodstream where you want it. So by kinking that off, it makes it go only into the bloodstream instead of back up into there. Does that make sense?
Yes.
Okay. All right. So like, say you have something that it takes a while to push it, like that low pressure, like I was just saying. So what I do is I'm looking at my watch, I push a little bit, and then I unkink my tubing and I wait a little bit. So like maybe I push a little bit, I wait a good minute or something, and then I push again after that minute's done while I'm kinking off my tubing, and then I wait a little bit again, because it's over 5 minutes, so you have to kind of spread it out a lot. Just realize that anytime you do an IV push, it matters like how fast you push that in. So some medicines can hit you really hard when you push too quickly. So you have to, be kind of slow with your IV push. Okay. Now, IV pushes can be very dangerous. So there's certain things you should never do IV push. Can you guys think of one in particular that you should never do that way?
Wait, I'm sorry. He said again.
What's a medicine that you should never, ever give IV push?
I would say like opioids, like morphine.
No, morphine you can give IV push. Potassium is something that you should never give IV push. So keep that in your head and always remember that. So with potassium, if you did that, if you gave it IV push, you could stop someone's heart. And so many times, like people on death row, you know, who they're going to put to death, that could be one of the things that they do to get their heart to stop, you know, give that IV push. I'm going to put my headphones on because my family just got home and they're going to be loud. So 1 second here. You still hear me?
Yes.
Guys, can you hear me?
Yes.
Yes.
Okay, just want to make sure. Okay, so yeah, so potassium, something you would never give IV push. So just remember that. All right, so that's the IV push side of things. Now, we talked about when you already have fluid going, if it was someone who just had like a hep block there, that they have an IV site, but it's not hooked up to anything, then you could still do an IV push, but you would have to bring some flushes with you. So you know how they have the pre-filled syringes that are full of saline. So if this is just a peripheral IV, typically you would only have to, maybe do like a 3 cc syringe full of saline. You would flush those 3 cc's before, and then when you're going to give the medication, you would give the medication however quickly it's said to give it in the book, and then afterwards you would flush afterwards as well. So these flushes, those are just like giving an IV push basically, but you have to, make sure you're doing it kind of slow. A lot of times certain people are very sensitive with what you push, and so some people just like really are, they feel like it's very uncomfortable when you're pushing the saline even. So any questions about that?
No.
Now, you guys know that anytime you're going to give anything through an IV, before you even give the med, you always should pull back for a blood return to make sure that you're in the right place still. Because if you don't do that and you're not in the right place, you could cause bigger problems, right? So with the syringe that I have my medication in, I can pull back a little bit to see if I get that little bit of a blood return right there in my IV. I don't need like a ton of blood there, but as long as I see that there's something coming back, I know I'm good. I'm in the right place. So that's like a step that you should also include in all of that we just talked about. Okay, so I'm going to talk about IV bolus next. So from what I could tell in your modules, it looks like they do the bolus a little bit weird in here. They kind of think of a bolus as like an IV push in a way, which I guess, yeah, kind of it is. But when I think of a bolus, I'm thinking of giving a certain amount of IV fluids in a bag over a short period of time. So for instance, like say you're on your floor and you have a patient who has a low blood pressure. This is really typical. Like you could be working night shift and someone has a low blood pressure and you call about it, and 9 times out of 10 they'll be like, oh, give them a 500 cc bolus of saline. And so when you go do that, you have to, get your 500 cc bag of saline. You would prime your tubing, which is, I think, what Tanisha was saying you guys kind of learned how to do in lab. So you would get your primary tubing, you would hook it up to the bag, and then you have to run that fluid all the way through the tubing and then clamp it off, right? Before you would do anything with it. You guys
Yeah,
did?
that's what we did.
Yeah. So with this bolus, you would have to do that, right? So you get your 500 cc bag, you get your primary tubing, you put all the fluid through there, and then you would hook it up to the patient. And then what do you think we set this at when we put it on a pump? Any thoughts? Like if your order said, give a 500 cc bolus of saline now, how fast would you run that?
Like, are you asking time-wise?
Well, like what would you set your pump at? Because your order doesn't tell you. It just says, give a 500 cc bolus of saline now.
I don't know, like 30 minutes.
So we want to give this patient this whole amount of fluid in a short period of time. So we're going to set this pump to go as fast as it will go. So how fast do these pumps go?
Is it 50 mil?
No, they'll go up to 999 cc's an hour. So you would set it at 999, so that's how many milliliters an hour you're having this thing run at.
So then it's still.
So you can imagine, like you have this big thing of fluid and it's going to go in really quickly. You know how it has the drip chamber and you're watching it drip?
Mm-hmm.
So when you set it that quickly, it'll go like super fast, right? And so it's only going to go over so many minutes. And so the whole point in the bolus is that the patient is dehydrated or something, and that's probably why, they're having this low blood pressure. So they think that if you give them this amount of fluid in a short period of time, that it'll improve their blood pressure and kind of get them back to where they want them to be. Now, there's other times where, you might have an order that says, like I used to give amiodarone a lot on the floor that I worked on. And amiodarone is an antiarrhythmic medicine that you give for the heart, like when people have irregular heartbeats and stuff. So we used to give it for atrial fibrillation a lot. And so when you had an order for that, the doctor would tell you to do the amiodarone bolus, and that was 150 milligrams over 10 minutes. And so when you get that from the pharmacy, it's like maybe a 100 cc bag. And so when you set that on a pump, it would be like, I don't know, 616 milliliters an hour, something like that is what it ended up being that you would run it at. So it would literally go really quickly and it would go in over 10 minutes because it's only 100 milliliters of fluid. And then you would have an order to give amiodarone at a certain amount after that. It would slow down after that, but you would give a bolus first to get more of the fluid in their system quicker, and then you would give them the medication a little slower after that. Have you guys heard of that before, giving a bolus of fluid?
Yeah.
Now
Just-
oh, go ahead.
I said yes, but just in theory.
Okay. Now, there's going to be times where maybe you'll have an order that says, hey, give 250 milliliters of fluid over 2 hours or something. And then you would have to do a calculation to figure out how much you're going to run it at, right? And this is that milliliters per hour calculation. You guys remember how to do that?
Yeah.
So in this case, if we wanted to give 250 milliliters over 2 hours, what would we set our pump at?
125.
Yeah. So you basically take the 250 and you divide it by 2. That's all you're doing to get the amount. Now, I told you guys on your test that you're going to have next week, you have 3 math questions, right? One of the math questions has to do with time. And I don't know if we've done a ton of those before, but so basically, like, say you have a question that says, I don't know, I'm giving someone 750 milliliters of fluid over 4 hours or something. And so you start it at 8 o'clock in the morning. What time would this be done? That's the type of question that this is that you're going to have. So basically you take that 750 milliliters, you divide it by 4 to say how long it's going to take for this to go in. And then however many hours that is, you add it to your time to see what time it would be done. And so your answer would be the time. What time is this going to be done? And you always do it in military time. Can you guys I don't know if I gave you a good example or not, but can you figure that out?
Eight
750 over how many hours?
Let's see, I think I said 750 milliliters, and it's going to go in over 4 hours. That's kind of a crappy one. Here, let me think of something else. Hold on. How about, let's see, this person's getting 1,500 milliliters. It's going to go in over 12 hours. Let's see if that works. Yeah, that's a little bit better.
So you want to know how many milliliters per hour?
Actually, I'm
So
telling
125.
Here, hold on, you guys. Hold on. So your question, I told you this a teeny bit wrong. Your question is going to be like, okay, I'm giving this amount of fluid, 1,500 milliliters, and I'm running it, and it'll tell you how fast the pump is running. And then you'll have to divide by those. So like maybe it says, I'm giving 1,500 milliliters, and my pump's running at 125 milliliters an hour. So you would take the 1,500, divide it by the 125, which is 12, and we said we started it at 8 o'clock in the morning, so what time would it be done?
8 at night.
Yeah, and so you would put
1 o'clock.
yeah. So that's what that problem is like, just so you're aware. So it's very similar to stuff we've done before. It's just a teeny bit different.
What was that time that it was started at again?
8 o'clock in the morning.
Oh, 8? Okay, then that's fine. 20,
Yeah.
okay.
Yeah. So just make sure you're writing, military time correctly, because a lot of times people will put 8 p.m. or something instead of writing 2000. So just make sure you're looking at that right. Okay, the last thing we need to talk about is IV piggybacks a little bit. So let me see if I can share my screen a second. Okay, so with IV piggybacks, this is typically going to be like an antibiotic or something along those lines that you would give this way. So it's always going to be a small bag of something. And so when you give it, you always would hang this higher than your primary bag, your running fluids that are already going. So on this, here's like an example here. So when I hit secondary tubing, you see this here is your secondary tubing. So the tubing itself is always going to be shorter than your primary tubing. So like whenever you have to go get tubing out of the the room that has all of the supplies, if you're ever worried about which one you're picking, the secondary tubing always says secondary tubing on it. It's shorter than the longer tubing, so you know you're looking for something that's shorter. And then this is the one that also has the hanger in with it. So you know how certain things have that hanger so you can hang it on the pump? That's what this one is. So that's how you would know that's the secondary tubing. And then the other thing about the tubing itself is it doesn't have a ton of ports on it like the primary tubing does. So you'll have like one of those clamps on it, and it basically has one port at the end, and that's it. So whereas your primary tubing is going to be really long, and typically it's going to have a lot of different ports along it. So when you hook up a IV piggyback, you're going to, prime your tubing like we talked about before. So you would do that for this one, and you would do that for this one if they didn't have both of them up already. then how you know where to hook it up to along the primary tubing is it's going to be the very top port, the highest port on your primary tubing. That's where you're going to put it. All right, and then whenever you're doing an IV piggyback, you always have to use that hanger. The hanger is for the bigger thing of fluid, your primary fluid. So that's what you're going to put lower. The whole idea with IV piggyback is that the smaller bag is going to go in first because it's higher than the bigger bag. And so when this is done infusing, then the bigger bag will start in. So again, you know, typically this is like an IV antibiotic or maybe even an electrolyte like a magnesium or calcium or something like that that you're hanging. So, you know, you have to look at your order when you go to do this to see how long it's going to run for. So when you're putting it on the pump, you have to dial it in, you know, to dial it into your pump how long it needs to go for. So the nice thing is we have those smart pumps now. So hopefully, you know, by the time you guys get back to the hospital, you'll be able to work with the smart pumps a little bit. The nice thing about those is when you know, it has a menu for all of the different names of all the medicines. So like, hey, maybe this is Rocephin I'm giving. So I look up Rocephin and you put it into the pump and it knows what you're giving. So it'll tell you how much is in the bag and like what the concentration is. It tells you everything. And so it's really hard. You can still make a mistake with a smart pump, but it's kind of hard to because it really helps you along and gives you a lot of information. So typically on your secondary bag, you know, your antibiotic or whatever you're hanging, on that bag there'll be a label. And so everything that you dial into this pump, you need to compare. So you need to say, okay, this is ceftriaxone. Hey, this is ceftriaxone. This is how much I have. I don't know, 1 gram. This says 1 gram. This says that it's in a 50 milliliter bag. What does this say? Sure, 50 milliliter bag. So you need to make sure everything matches. And then usually it'll come up with whatever the pump is supposed to be set at already. Like you don't have to put it on there. Occasionally you do with certain medications. So if that was the case, you would look onto that label and it'll tell you right there how fast you have to run it at. So you would put that into the pump, and with this, you know how we have clamps along both of these tubings? So with this secondary tubing, you would undo your clamp so that this could run in first. And then the other clamp would also be undone for the primary tubing, but it wouldn't be running in at the same time. It would just be the small one running in first because it's up higher. So, and then the pump kind of controls how fast it runs. Now, years ago, people used to actually count drip rates and all that kind of stuff without a pump. Like you didn't put stuff on a pump and you would just like calculate how fast you wanted it to drip and like control it with your roller clamp, which was crazy. It just seems so unsafe, you know? So there are times where maybe someone might run something without a pump, but mainly you're going to see everything on a pump anymore. That's kind of an outdated practice. Here's kind of a better picture down here of the secondary tubing. So again, you have your drip chamber, you have your clamp, and then just the one port on the end, and that's it. So anytime you hang something and it's something new that you hung, you always put a label on everything. So like your secondary bag, you know, it should have a label on it, so you don't have to worry about that part. But like the tubing itself, you should have a label on that. How often do you have to change IV tubing? It's on this page right here. Every 72 to 96 hours, depending on your facility's policy. So typically you keep track of that with these little labels, you know, so you would put on there what date you hung it so that the next person following you would be like, oh, okay, it was hung this day. I know it's okay still. Or no, it's going to outdate today. I need to change it, you know. So good practice to do that. You always have to label. Now on your primary bag, you know, this big bag that we're talking about here, you see how they have a label on the bag itself. That's always a good thing to do when you hang a bag newly, because sometimes you have a big thing of fluid up and it takes a while for it all to go in because of whatever rate you have it set at. So you would want to label that too, because that shouldn't be hanging for like all week or something. That's just not good. You need to know what day that was hung so that you can adequately change things. Now, there's certain fluids, like say this was a heparin drip or amiodarone or something like that. There's certain things that you have hanging most of the day that you want to change daily. So like a heparin drip, I would not want to keep that up, you know, for 3 million hours on end. So I would probably put a new bag up the following day if it wasn't gone. Now, you guys remember back to doing the drops per minute questions? Do you remember that?
Yes.
So sometimes you'll see in drops per minute questions that you might see something that says, oh, this person has a micro drip, or this person has a macro drip. What that has to do with is the drip chamber itself and like how fast things are dripping, right? So can you guys see this picture right here? I don't know if since I switched things, if you can still see it. Can you see it?
I can see it.
Okay. So on the one on the left, this is supposed to be a macro drip. So you see how it's dripping? It's a little bit bigger of a drop. And then look over here to the micro drip on the right. So there's like a little thing to make the drop itself smaller. So anytime, like if you would have a question that would say, I have a macro drip or a micro drip, the micro drip's always going to be 60. So like if it didn't give you a number and it just said you had a micro drip, you know it's 60. So that's what you would put in there. If it's a macro drip, it could be anywhere from 10 to 15. So typically you don't see them say macro drip very often. But the micro drip I do see kind of often. So just so you know that part. Okay, we probably should do a couple of math problems just to be on the safe side so you guys remember some of these things. So let's do a drops per minute question. Let me find one for you. Okay, let's do this one. So you have an order for 500 milliliters of normal saline, and it's going to be up for 4 hours. And it says you have a micro drip at 60 drops per milliliter. So we need to figure out how many drops per minute this is going to be. So see if you can figure that out real quick.
$125.
Yes. And then if I said we had a macro drip instead, and the macro drip was 20 drops per milliliter, now figure it out.
$42.
Yeah. So it comes out to something like 41.6, but then, you know, typically pumps, you don't always have that luxury that you could, you know, make it point whatever. So typically you would round it to a whole number. So did everyone get that? So remember, you always take your volume times your drop factor over your time in minutes. So we said it was supposed to be up for 4 hours. So how do you figure out that time?
60 times 4.
Okay, here, let's do one more of those kind, and then I'll tell you something else here. Okay, so this one says we have an order for 500 milliliters of D5W. It's supposed to be up for 24 hours. And we have a macro drip of 10 drops per milliliter. So how many drops per minute are we doing?
.5.
Wait, how many, what, oh, you said 10, right? Yeah, 3.5.
Yeah. And then if we said a micro drip of 60 drops per milliliter, if you put that in instead of the 10, what would you get?
.21.
Yeah. Okay. All right, and then I wanted to show you something else real quick. With these time problems, let's see if I can do this on a whiteboard possibly. I can't write really good on here. This is going to look crazy, but hopefully you'll understand what I'm trying to say. So we have an order that says we have 500 milliliters of normal saline, and it's supposed to infuse at 75 milliliters per hour. What do you get when you divide those?
6.6666.
Okay, so how would you figure out the time then? Because typically when we want to know the time, so like say, you know, typically this would be like 6.6 and repeating, right? So the 6 hours, it would go in 6 hours, but how do you figure out the minutes?
Convert the 70, wait. Convert the hour to minutes.
So,
6.
so if you had like 0.66
That's 396 minutes.
times 60, what is that?
396. Oh, 6.6. Oh, hold on.
40.
Is 0.66 or 6.6?
0.66 times 60, what is that?
40.
Okay, so this would be 6 hours, 40 minutes. Or, you know, if you want to be a stickler and like round this to 0.7, you could do 0.7 times 60, and then it would be 6 hours, 42 minutes, you know.
Oh, okay.
You
Makes
see what I'm
sense.
saying? So
Yeah. Are we gonna get a question like this?
the one that you have, I think, is simpler than this. So I don't think you have to worry about the timesing it by 60. I think it's just like a simple, hey, it's this many hours.
But if we have to like times it by 60, would it say that how many hours and how many minutes? So we catch it that it's, you know, it wants us to really convert.
So when it asks you a time, whenever you get a problem like that and asks you a time, you're going to put whatever time it is. Like you want to know hours and minutes. So like the one that you're going to have on your test, you're not going to have to worry about the minutes because it's just going to be like a time, like so many hours, and that's it. So there's nothing to convert or do because it's already that. So anytime you would have a problem like this, if it comes out kind of uneven like this, where you would have to convert, that's all you do is multiply by 60. So you always just take, it to 2 decimal points. So if it's like a repeating number, take it to 2 decimal points, multiply by 60. And then whatever you get, you would round that to a whole number. So like if this was something that wasn't quite, you know what I mean? Does that make sense?
Yeah.
Okay. I just wanted to show you that because I don't know that we've ever done that before. So just so you know how to do that in the future if you ever see that. All right. Is there any questions about Ivy piggybacks? Like when you guys were doing your stuff, did you have any questions about anything they said or anything?
No, I don't have any questions.
Okay, well, I'm gonna leave it at that then. It's not like a ton I can say about it, It's easier when we're actually at school and I can show you things and talk about it at the same time. But so just know, I don't know if I told you guys this, but we had a meeting, I think this was Wednesday, and they said that they're starting to talk about bringing people back to campus to do checkoffs, for lab, because there was a ton of people who got incompletes. They were still able to complete their class, but they weren't able to, have an actual grade until that lab portion is checked off, So they're trying to figure out logistics for this. So this could be happening, in the next so many weeks where people start coming back to campus to do those checkoffs. So they're going to focus on all those incompletes first. And then you guys need to be there too, though, to do some of your stuff. So what they'll do is they'll give you like a certain amount of time to practice skills there. And then whenever, there's a time to check off, you'll come back to check off as well. Did you guys get it incomplete for last term or no?
I think we all did.
I didn't see one.
So
On the thing, if you look on your go to I can't remember how to get on it, but if you look on to see the grades for the last semester, it says incomplete. That portion is incomplete.
Yeah, that's why, because you need to be checked off on that stuff.
Yeah.
So just know that could be coming here pretty soon. They'll let you know ahead of time so you know, but just know that they're talking about it and that's coming sometime soon. So it sounds like there'll be a bunch of instructors there. You'll get time to practice, like so many days to practice, and then they'll bring you back on another day to do the checkoffs. And they'll be pretty good about it. I don't think it's going to be too bad. But yeah, we want to try and get all of that, incomplete stuff taken care of as quick as we can, and then we can worry about anything else.
Okay.
Okay. All right. So I know there's a couple of you who still needed to do this module. So make sure you get in and do this module so it's done, before your due date. And then Krishna, do you need me to change times or dates again for that first bit of stuff that you didn't get done? Because I thought I did that already, but I don't see that you did it yet.
I don't need it changed. I'm getting it done slowly because I'm still trying to catch up with everything.
Yeah.
But like I worked on some of it yesterday, and I'm still working. I'll finish it by the end of today.
Oh, that's fine. I'm no rush, but all I'm saying is I don't remember what date I put in for the the end date for that. So if I need to change it again, I can. Just let me know. I just want you to be able to be back to where you need to be with everyone. So.
Okay. Yeah, I should definitely get it done by the end of this weekend because I have Thursday through Sunday off, so I should be able to get it done.
Okay.
Miss Silks, I have a question.
Yeah.
So these checkoffs, do you think it's going to go throughout the entire semester or something like that? If possible. I know you said soonest, but since they are starting with, the incomplete. I'm just wondering.
I'm not sure how that's going to go. I mean, like, we won't be on campus for class still. The rest of the summer will be online like this. That's what they told us in this meeting. But these checkoffs, you know, they're trying to make it so everyone's socially distant from each other and all that kind of stuff. So it's kind of a big deal trying to figure all that out. But
Okay.
I'm not quite sure how that's going to work because you guys had part of your lab on campus and were checked off on a lot of things. So I don't think
Yeah,
you
we
need
did that
everything.
part.
I think it's just the part that you know, had to do your online stuff for is what we would check you off on.
Yeah, and we for one of our classes we didn't do the head to toe assessment, so I think that was a huge part of it.
Oh, for a health assessment?
Yeah.
Yeah. So, you know, just know they're not going to make you check off like immediately, right? When you get back to campus, you'll get to practice and stuff, so it'll be fine. They're not going to make you check off. All right. Anything else you need from me?
Nope.
Okay. Well, I'm going to go ahead and get off here. I'll work on your tips thing for your test, and I'll send it off to you guys here in a little bit. So it takes me a little bit to go through all the darn questions. So thank you. All right, no problem. You guys have a good weekend.
You too.